Why are HAIs so common? 1. Microorganisms in the environment. 2. Patients are susceptible because of their weakened state of health. And 2. The chain of transmission in the hospital. All three of these risks together pose for a patient developing an HAI.
Ready? Some of the most common healthcare-associated infections are central line-associated bloodstream infections and catheter-associated urinary tract infections. Bloodstream infections occur when bacteria or viruses enter the bloodstream through the central line. Catheter-associated UTIs are the most common HAIs that we know of. They occur from prolonged use of the catheter, and they can affect any part of the urinary system. And they account for 75% of all UTIs acquired in hospitals.
IHNI are ventilator-associated pneumonia, which is a lung infection that is developed in a person who is on a ventilator. A ventilator is a machine that is helped to use a person breathe by giving oxygen through the tube that is placed in the person's mouth, nose, or in the hole in front of their neck. An infection may occur if germs enter through the tube and get into the patient's lungs. The other example is surgical site. This is an infection that is occur after surgery in the part of the body where the surgery is took place. Surgical site infection can sometimes be superficial infection, which involves skin only. Other surgical site infection may be more serious and involve tissue on the skin, organ, or implanted material.
Another factor that can reduce the incidences of HAIs in the hospital is the cleanliness of the environment at the hospital. This means keeping all rooms that patients are in clean, making sure all medical equipment is disinfected before and after patient use, keeping public rooms and bathroom facilities clean, wiping down surfaces in the hospital that become contaminated with possible bacteria, using the proper protective gear when around infected patients. All these factors and more influence the rate at which HAIs are spread. Patients also have a responsibility. This means making sure your attending nurse or doctor has washed their hands before examining you, and making sure they are always using clean equipment or tools, and notifying them when you see basic patient care is not being done correctly. Patients as well as hospital employees are responsible for limiting the exposure of these infections. Don't be afraid to question or speak up. It may be the one thing that saves you.
Okay. Hi, my name is Tara Grover, and I'm doing an interview on hospital-acquired infections.
Hi, my name is Tammy Grover.
Are you familiar with hospital-acquired infections?
Yes.
What are they?
Okay, so it's an infection that you receive after during your admittance or stay in hospital.
Okay. Have you ever had a hospital-acquired infection?
I have.
And what was that?
It was MRSA, and I acquired it approximately 8 years ago after a hysterectomy.
How did they treat your infection?
I was sent home. The hysterectomy was fine, but then after 2 days being home, I developed an infection at the incision in my abdomen, and it was hot, red, and tender, and hurt. And I went to my doctor, who said, "Oh, it's just, it's obviously an infection, but it'll go away." And it did not. And about 6 or 8 hours later that evening, I actually went to the hospital. And upon going to the ER, I literally did have the doctor, the ER physician, and the nurses hands off as they, did, once they did the initial finding out what was wrong with me and why I was there, literally had their hands up and pointed to the box of dressings to cover it and asked me to cover it myself. They began washing everything in the room. Did say that they could not guarantee that I had acquired it at the hospital. However, I had just gone to the hospital a couple of days before that for a major surgery, a hysterectomy. I ended up receiving antibiotic by way of a needle in my bottom, and I had to go back 2 times to receive that. The only thing I can think is that when I was home, I didn't keep the area clean.